Hi everyone, I am Dr. Saritha Prem, Director of Surabhi Ayurvedic Hospital. And here I am with a new topic, male infertility. Its causes, its investigation methods and also diet and Ayurvedic treatments. When we call a male, that is he is infertile, that is he is not having a good fertility power. So when a person is unable or the inability of person to raise a progeny is called as infertility. That is especially a male, when he is unable or unable to raise a progeny, that condition we call it as male infertility. So Acharya Charaka had explained very beautifully what are the factors which is very important for the production of proper progeny. So when the mental state of a person is normal, that when he is especially mentally when he is stable, and when there is a proper functioning of his nervous system, and when there is a high deposit of sperm in the vagina, and when they have they are following a good lifestyle, a good conduct, and the happy mind leads to a good procreation. So this is a concept which Acharya Charaka told in our science. So what are the causes of male infertility? We can see many causes nowadays. Even the patient, when a male is coming, they used to hesitate to tell this is my problem, or this is the cause which I am facing, like that. So when we are asking repeatedly many questions, they used to come to the point. So finding out the cause is very important in male infertility treatment trial. So you have to find what are the causes. So some of the common causes are premature ejaculation, so untimely ejaculation of the semen, and also erectile dysfunction. And the next one is sperm abnormalities. Sometimes there will be lack of motile sperms, or there will be the presence of abnormal sperms. And there are the other causes can be any genetic or any congenital deformities, and lack of proper count. That is very important. That this is one of the conditions which we commonly see in our clinic. That is oligozoospermia. That is when the sperm count is below 20 million, we call it as oligozoospermia. And azoospermia is another very common condition which we can see nowadays in the clinic. That is, azoospermia means there is lack of sperms. There won't be any spermatozoas. And the other condition is necrozoospermia. Necrozoospermia means there will be the presence of dead sperms. When we do the analysis, we can see more dead sperms in that. And the other causes are increased level of anti-sperm antibodies, the hormonal imbalances, and excess intake of alcohol, smoking, and also lack of proper exercise, obesity, and when there is any obstruction in the genital tract. And also another one of the condition is defect in spermatogenesis, when there is any defect in the production of sperm. And also another one common condition is hyposapidis. That is, hyposapidis means when the opening of the penis is under the underside than the tip. So the tip opening will be little underside. So this are also some of the causes. Rather than this, other causes are a lack of proper physical activities, and also lack of libido. That is when the person is not having any interest in sexual intercourse, and when there is no proper concentration, when they are having extreme stress, all can lead to infertility in male. So this erectile dysfunction, we know sometimes the person, he used to hesitate to say this is one of my thing which I am facing. So when we are continuously asking him the question, he will come to this point. So erectile dysfunction is also very common nowadays. And the other common condition is varicocele, and sometimes abnormalities like absence of testes, and also when there is increased thermal that is temperature of the scrotum, that is scrotal temperature, when it is increased, all can lead to male infertility. So nowadays we know all the guys, they like to wear very tight dresses So this also can be a factor in extreme increase in scrotal temperature. So this type of causes you have to find out. According to Ayurveda, there are some specific causes for this male infertility. One is Shukra dosha. We call it as Shukra dosha, means the abnormality, that is morphological or motility defect of the sperm, and means lack of good sperms. And also the next cause is aharaja, that is improper food intake. So sometimes the combinations won't be correct, excess intake of unhealthy food, and also ati vyayama, that means excess exercise. That means some people will be doing more exertion. So it can lead to lack of proper strength and lack of interest in the sexual intercourse and all. And the other, even avyayama also, that is lack of exercise also can lead to, can affect the fertility level. And the other cause is the abnormality, as I already told, and the mental state. So if the person is extremely having more stress, so if his manasika doshas are not normal, sharirika as well as manasika doshas must be stable. That is very important. So you see, when there is exertion and it is more, the vada dosha, as in our concept, it will increase more. So these all things can lead to male infertility. So what are the investigation methods? Here we have to, we can have many investigation methods like semen analysis, Doppler test, and also blood investigations in order to find out the exact cause. So when we do Doppler, we can understand if there is any venous blockage like varicocele, all we can detect in that. And also semen analysis, we can find out how much quantity of sperms are there, and how much motile sperms are there, how much non-motile sperms are there. So if there is any presence of pus cells, all we can view through this analysis. And now important part is diet. See, this is the common condition cause we can see in this condition, because nowadays people are not aware about what they eat. See, all the disease, whatever it is, it happens from the improper intake of food and our activities. As in my almost all the videos I used to tell, when a person is having a good appetite, and when he is consuming good levels of food items, and if he is having more intake of water, that is adequate intake of water according to his weight, definitely he will be free from diseases, because he will be having the immunity power. So here also food is very important. So when you are concentrating for the purpose of fertility, you have to take more nuts like walnut, dry fruits like fig, dates, and also cashew nut, ground nuts. You can have all these nuts. At least a handful of mix of these nuts is very good for you to take daily. And intake of milk, ghee, all can increase the production of sperm. So in order to purify the sperm, you can have 1 glass of sugarcane juice and fresh juices, and also intake of more vegetables, and try to reduce all the junk foods. And you can have good vegetable soups, even bone soups you can have in order to gain the strength and all. And you can have more fruits, which is very rich in vitamin C. Almost all the fruits are having a good content of vitamin C, but you can take it as a regular basis, you can have it. Try to reduce stress, that is very important. If you are not able to concentrate, or if you are not able to do any more exercise, try to at least follow some yogas, yogasanas or pranayama, which helps you to control yourself. So which helps you to increase your mental capacity. That is very important. And the other thing is treatment. So here is the very important point, what to select. That is, the line of treatment is very important. So in Ayurveda, we have, first of all, we used to advise them the lifestyle modification, and after doing the investigation, we'll find out what is the reason of the condition. And the department which deals with the sexual well-being is Vajikarana, that is aphrodisiac drug, that aphrodisiac treatments. will be dealing with Vachikaranna Chikitsa. And also the common treatments which we advise in, especially Panchakarma, is very beneficial, especially in that Vasti is very important, which we used to advise here. Before that, the Purva Karmas like Snehapana and Abhyanga, Avagaha, Svedana, all according to the condition we advise to the patients. And Vasti like Uttara Vasti is very important, Sneha Vasti, Matra Vasti, depending upon the main causes, physician, an Ayurvedic physician can direct. And also some of the common drug of choice are Shatavari, Ashwagandha, Kapikachu, Amlaki, that is Emblica ribes, Emblica officinalis. All this drug we can take it as a choice. And there are a lot of preparations, medicine preparations. We know Ashwagandha is very popular in the treatment of fertility because it is having lot of actions, that is Withania somnifera we call it as. So it increases the sperm count, it purifies the sperm, it also removes all the dead sperms, and also it increases the good sperm count. And it's also very much beneficial in erectile dysfunction and premature ejaculation. When a person is having a daily intake of at least Ashwagandha once a day, definitely he won't be having any tiredness or any other issues in this during the sexual intercourse. And the other thing is very important is some of the preparations are there. So blindly don't take any preparations by reading any books or all. You have to consult a physician and you have to take a proper medications. So there are a lot of aphrodisiac drugs in Ayurveda like Ashwagandha Arishta, Ashwagandha Lehya, and also Kapikachu, that is which is a drug of choice mainly we use to indicate in erectile dysfunction. And Ashwagandha various preparations are there. And also Yogaraja Gugulu, Pushpadhanvarasam, all these medicine preparations we use to advise in order to remove the defects of the sperm. Whatever it is, whether to increase the count or whether to increase the motility, all things. And Yogaraja Gugulu also we used to advise in order to remove the tubal blocks. And if it is varicocele means the medicines will be on that line. So the line of treatment will be in order to treat the varicocele condition. So these are some of the common points which we have to remember in male infertility. So some used to ask me whether excess when the masturbation, if it's excess, is dangerous for affect the fertility level. Definitely it can because excess usage is also very dangerous. So that also keep in mind. So hope that all these points are very useful for you. Share this video to maximum and try to subscribe our channel if you are not yet. And you can join our WhatsApp link so that if you have any comments, you can post in comment box as well as you can ask to us personally. So we'll see you with a new video next time.